Okay, perfect. It just started recording, so we can go ahead and get started. Well, hello everyone, and welcome to our Solving the Top Five CRM Challenges in the Healthcare Industry webinar. My name is Brittany Olvera, and I'm part of the marketing team here at Imperium Dynamics. And joining me here today is one of our members from the Business Analyst Department, Anna Maria. Welcome, Anna Maria.
Hi, everyone. Thank you, Brittany.
Thank you. Thanks so much for being here. And really quickly, if you are new and joining us here today, we are Imperium Dynamics, a proud Microsoft partner based in downtown Chicago, dedicated bringing your vision life within the Microsoft stack. We aim to help organizations of all sizes achieve digital transformation by solving complex problems and delivering long-lasting impact through the Microsoft Cloud solutions with a focus, of course, of increasing both the capabilities of people and the performance of businesses. And really quickly, before we get started, a few housekeeping items. The session is being recorded, and after the webinar, you will receive an email with not just the recording, but the slide deck as well. So you can feel free to revisit it or share it with your colleagues. If you have any questions throughout the presentation, feel free to drop those in the chat and we can reply as we go. And with that said, we can just really quickly go over the agenda where we will be discussing the role that CRM systems play when managing client relationships, showcasing, what are the 5 CRM challenges and how can we solve them? And then overall the benefit and the impact these solutions will provide for your CRM. And with that said, the 5 major challenges in CRM can be number one, data silos. Number two will be the inefficient patient engagement. Number three, rehab adhering to patient preferences. Four is the fragmented patient care experience. And lastly, the 5th CRM challenge is the inefficient financial communication. And on the right here, we have an industry fact stating that fragmented records are a significant major factor in medical errors, with studies indicating that 30% of healthcare providers report errors due to incomplete patient information. So, with that little fun fact there, we can hand it over to Anna Maria that will showcase the top 2 CRM challenges.
Thank you so much, Brittany. So let's dive into challenge one, which is data silos. One of the biggest issues we hear from providers is around collecting, organizing, and storing data across multiple systems, whether it is electronic health records, billing platforms, or patient feedback tools. Without a strong CRM system in place, this process can be not only time consuming, but also expensive and inefficient. That's where Dynamics 365 Customer Insights helps. It is a platform that unifies patient records into individual files, automates data collection and organization, and ultimately makes information much easier to access and act on. This improves data quality, enhances provider access to information, and gives a complete 360 view of the patient all in one place. So let's take the example of Karen, a care manager at a multi-location clinic. Her job is to coordinate patient care plans, but she often faces challenges accessing unified patient data across different systems. This fragmentation causes delays and affects the quality of care decisions. So let's walk through how our CRM platform helps change that. Karen starts by logging into the Healthcare Administration app, which is part of Microsoft Cloud for Healthcare. She opens the Dynamics 365 Customer Insights dashboard and navigates to the patients list. And from the dashboard, Karen selects a patient to view their full medical profile, and she now has access to a complete patient snapshot, including allergies and sensitivities, contact information. She can also have access to active conditions, such as chronic fatigue syndrome. And down below, she also has access to medications and prescriptions. And she can also view the lab results and the procedures that the patient has had so far. Next, she can click on the, let me see, it's not viewing. There we go. Okay. And here we can see the lab results and the procedures. And then she can click on the clinical timeline. Um, the system aggregates historical procedures, lab results, and encounter history into a single view. And that makes it easier to follow the patient's journey. Here we can see all the lab results, the history of all the procedures that she had. And then she clicks on the care team tab, and that shows the list of specialists involved in the patient's treatment. This ensures that she knows exactly who to follow up with. And to coordinate care, Karen then opens Microsoft Teams and navigates to the healthcare team channel. From there, she accesses the embedded patient app and she can see the same data in real time with her colleagues. Here she can view all the patients and she can click on the same patient and view all the details about them. It basically gives a summary of the patient. And then she can also go back and she will post an update like the patient had an ER visit due to an allergic reaction, and she can also inform the rest of the colleagues about any critical information, and she gives the link so they have access to all the data that they need. With a unified view of patient data and real-time collaboration, Karen is empowered to make faster, better informed decisions, resulting in more coordinated care and less time spent chasing information.
Awesome.
Okay.
Thank you so much, Anna Maria. And on to
Of
challenge
course.
number two.
Okay, moving on to challenge number two is inefficient patient engagement. And we all know how important it is for patients to have a seamless experience across different healthcare services. But engaging with patients can be difficult. Everyone has different needs, preferences, and expectations. And when you're dealing with high volumes of patients, maintaining consistent and effective communication becomes even more challenging. Um, with Imperium Health Cloud, we offer HIPAA compliant texting that sends automated reminders and messages. It provides patient portals and helps streamline and track referrals. This solution benefits both patients and providers by optimizing provider time, by reducing missed appointments, enhancing overall patient engagement, and also improving satisfaction through more personalized experiences. Let's take Brewer as an example, a patient who often misses appointments simply because he does not receive reminders in time. As a result, his follow-up care is delayed, impacting his overall treatment plan. But with automated texting with Imperium Health Cloud, things change. Brewer now receives appointment alerts ahead of time with the option to reschedule by replying directly in the message. This flexibility makes it easier for him to stay on top of his care and helps the clinic fill cancel time slots more efficiently. Now let's take a closer look at how appointment rescheduling works. So how appointment rescheduling is handled inside Imperium Patient 360. As you can see here, the status of the appointment has already been updated to rescheduled. Once that happens, it's automatically routed to a queue labeled appointments needing to be rescheduled. And this helps hospital staff easily manage upcoming schedules and ensures no appointments fall through the cracks. Now, switching over to the patient view, this is the conversation the hospital had with the patient, and it matches what we showed earlier in the previous slide. The patient received an automated reminder, replied to reschedule, and selected a new date and time, and all that happened through SMS. What's really helpful here is that since the patient confirmed they needed to reschedule, the original appointment slot can now be reassigned. That means fewer wasted time slots and more efficient use of hospital resources. Now we'll pass it over to Brittany for the rest of the challenges.
Awesome. Thank you so much, Anna Maria. Moving on to challenge number three, we have the adhering to patient preferences. So, managing sensitive patient data while also honoring their preferred communication channels and frequency adds just another level of or layer of complexity. And it's requiring really a robust system that ensures both the compliance and the personalized engagement aspect with the Dynamics Care Marketing 365 customer insights. It has Azure for regulatory compliance, and it also has the journeys for consent management and audit logs. So, with this, you are able to reduce risk in breaching valuable regulations as well as the enhancing patient security and trust. It also ensures accountability and transparency. And for example, if we just go to the scenario, we have here Taylor, who is a care manager, and she oversees the care for a patient, right? So after speaking with him on at a recent appointment, she wants to ensure that his communication preferences are up to date before sending out care plan notifications and appointment scheduling communication. So if we go on to the demo, there we go. So here we have that Taylor, and she begins by opening the patient's profile in Dynamics Customer Insights. And on the Communication tab, she can view Brewer's opt-in. So since Taylor's organization has recently been acquired, there has been multiple brand profiles, and they have been configured for their marketing communications. And Brewer has selected different communication preferences for each profile and communication channel. So overall, every message sent from the system is sent from a brand profile, and then the system automatically checks each patient's consent, as we can see here, for that brand, the brand to restrict sending to opt-outs. So the consents are purpose specific, such as important updates and marketing or appointment reminders. And here we can see that we're in the consent preference details, and we can see all the modified date and all of the consents which Brewer has opted in. And with that, we also have SMS consent preference. So for organizations utilizing the Microsoft platform for bidirectional text conversations, even more detailed SMS preferences can be captured and kept in sync with the electronic health record. And these consents are inherited from the HER and pushed back anytime a change occurs. So these preferences alert front desk teams and care managers of a patient specific opt in for texting, such as the PHI, and it can also be shared over SMS. And here it's just a quick overview of how we can connect the patient preferences and marketing channels with this platform. And moving on to challenge number four is the fragmented patient care experience, right? So unifying communications across multiple systems and entities can become a really difficult challenge, as well as the care plan adherence. So furthermore, organizations struggle to ensure consistent and cohesive communication. So a solution with this would be the Care Journeys app, and this can help care managers enroll patients in tailored care plans with automated communication to support scheduling and patient reported outcomes. And the benefit of that is not only personalized data driven care, but as well as you get a really clear tracking of the progress and the outcomes when it comes to intent. So, say, for example, Joe, a patient living with type 2 diabetes, experiences disjointed care due to the lack of coordinated treatment plans, right? So his care involves multiple specialists and departments, and there's no centralized approach to ensure all providers are aligned on his treatments. So then when we're utilizing the Dynamics 365 customer care journey, as we can see in this demo, we are in the care marketing app where care coordinators can actually come in and create structured care plans for patients like John, who is living, again, as we mentioned, with type 2 diabetes. And in here, we can see that John's care plan indicates his active medical conditions and recent encounters in the care plan goals. And then here, each care plan includes a series of activities and milestones that guide the patient through their treatment journey, which in Joe's case, he needs daily blood sugar checks. And this could be like daily 12-minute walks, monthly nutrition counseling sessions, and quarterly cardiologist follow-up. So he's targeting in a HbA1c below 7% and a weight loss goal of 10 pounds, right? So then Brenda, Joe's care manager, adds the latest activity and goal discuss with John and his physician into his care plan. So as we can see here, we are able to look up those records, such as the lose 10 pounds, the 7%, and add it into his care plan. And after we select go, then we can hop onto the journey. And here we can see that in all journeys, we have started his exact journey to ensure that he gets all communication, whether it's phone calls, whether it's emails, and that can vary within a span of a month, within a span of a week. And if we can see here, we can say wait 3 days, wait 3 days. And here it ensures that the journey is able to track what the goal is within his health issue here. So again, here's just an example of the detailed journey that the care manager is able to do for John, and basically ensure that he gets all communication not only on time, but seamlessly as well. And here we just get all of the information of John when it comes to his insurance, his emergency contacts, his patient history, as well as we are able to see the patient interaction timeline. So we are able to see whether or not John has opened that email, answered that phone call, clicked through it, clicked the important CTAs, whether it comes to scheduling a meeting, as well as his clinical nurses, his encounters and conditions. So again, just a unified view within his care journey. And lastly, moving on to the challenge number 5, the financial transparency and communication. So as we all know, patients often face uncertainty in regard to their financial responsibility for upcoming medical appointments or procedure. And with this comes the good faith law. Law requires the self-pay patients to receive estimates if they requested it. However, even if insured patients want to know their expected calls from healthcare services, this again could be insufficient communication with patients regarding their financial responsibility, and this can result in confusion and overall just a negative patient experience. So with the Imperium Health Cloud, the Good Faith Estimator module, we are able to produce a precise estimate of patient liabilities and share with them and their patients. So overall, the module creates tailored care journeys for individuals based on their data and just create to follow and track goals expected to be achieved by the end of the care plan. And overall, there's just a major benefit because not only does it allow the patient to see all the financial transparency and communication very detailed, but it's able to strengthen the patient-provider relationship, and it overall increases the patient's trust of the organization and provides more timely payments, you can say. And if we hop onto the demo here, we begin in the Imperium Good Faith Estimator app, where the front desk staff can view all of the open patient estimates, and these estimates have been automatically created for every appointment booked in the EMR. And each estimate includes the patient's details, appointment details, the primary payer, the insurance details if applicable, including deductible, co-pays, and the utilization to date. So the estimate codes display each line item for the expected procedure codes on the appointment, and the line items include any modifiers that indicate as well as the rate for the given fee schedule. And the estimate summary displays the total allowed amounts and estimated patient liability after insurance is considered. And here, as we can see, we are in the a specific patient portal where we can see all of their information, what the estimate cost will be. Again, and this is solely internally. And once the estimate is reviewed and finalized, then it is ready to be shared with the patient via text, email, or print. So here, when we click the text GFE, we're able to click that as well as the email. And then the patient will get an email saying, hi, the good faith estimate is attached. Please view the link. And once they open the link, this is the patient's view that they will see. Again, with all the patient details, the insurance details. And then if you scroll more down, here we get a detailed view of everything that involves with the patient's journey. So once they click sign off, then they can automatically sign it, and then the front desk managers are able to get the form back signed off from the patient. So really easy, really seamless, and again provides really clear communication and transparency when it comes to patients' trust and just them knowing 100% what they owe or what the insurance owes. So really cool tool there. Sorry. And with that, that's all the 5 challenges. However, we all know there's still a major challenge here. So I guess you can say the top 6 CRM challenges, and that is regulatory and compliance, right? So keeping healthcare CRM softwares compliant with current privacy standards is really challenging due to constantly evolving regulations and the complexity of managing sensitive patient data, which adds to another difficult level of ensuring full compliance. So just again, the evolving privacy laws that make it really difficult for CRM systems to keep up to date and always ensuring internal and external patient collaboration overall. With that, there's also the patient communication preferences that must be tracked and honored across all channels. And then the sensitivity of health data and information that requires strict control and constant monitoring. And then last, we have the non-compliance risks, which include legal penalties and loss of patient trust. So again, just gives you a really holistic view of the major challenge that really connects with the CRM systems and ensuring that your CRM system is up to date and provides seamless collaboration internally overall within all of your hospitals that you may have. And with that, here is just a quick overview of our featured healthcare clients that we have worked with, not only within their CRM systems to help them escalate their digital transformation, but also maybe providing the custom implementations that they may need within their practices and their hospitals. We have Allergy Partners, Indiana University Health, Baptist Health, Florida Orthopedic Institute, and as well as Rogers Behavioral Health. Again, all in the healthcare industry, might be facing different verticals, but nonetheless, it all involves the patient care and patient data. And with that said, here is a quick overview. Here we have one of our silly cute characters, Perry, and he is ready to break down the whole webinar summary of it all. So let's take a look. Patient data is all over the place. It's like trying to do a puzzle with pieces scattered in 5 rooms. Doctors need a clear picture, but without a connected system, they're guessing. Patients don't get reminders and miss stuff. When clinics don't have a smart way to talk to people, patients forget checkups or test results. It's like shouting into space and hoping someone hears you. Privacy rules are changing like crazy. HIPAA is super important, but also super tricky. Keeping up with the new rules is hard, especially when the tech isn't built to handle sensitive info safely. Care feels like everyone's on a different team. If one doctor doesn't know what the other one's doing, the patient ends up confused. It's like five coaches yelling different plays at the same time. And finally, nobody knows what anything costs. Patient get nervous when they don't understand what they owe. It's like being at a store with no price tags, and no one wants that. Finally, need a hand crossing the street of digital transformation? Imperium Dynamics is right there with you. Tech experts who know every turn, twist, and shortcut. They'll guide you safely down the road to success. Woohoo, let's go. And with that said, we have finally got to the end of our webinar. Thank you so much for joining the top 5 CRM challenges in the healthcare industry. We hope that we have provided some really insightful information for you. If you would like to scan the QR code to learn more of these solutions, feel free. But other than that, thank you so much for joining. Thank you, Anna Maria, for joining me and being a speaker in this webinar. And we hope you guys have a wonderful Tuesday. Thank you, everyone.
Thank you, everyone. Thank you,